Hello and welcome to the safety meeting for March 2020. In this meeting, we'll review incidents from February 2020 as well as observation card data from February 2020. We'll cover information on the coronavirus, COVID-19, and you'll be expected to complete fatigue management training and cold stress training on Wildcat University. Let's begin with a look at incidents from the previous month. As of February 29, 2020, we've gone 153 days without a recordable incident. Our last recordable incident was on September 29, 2019. A look at our incidents year over year shows that we had 4 incidents in February 2020 as compared to 0 in 2018 and 6 in 2019. At the end of February 2020, we had 4 yards with incidents occurring in them: Carlsbad, Odessa, Oklahoma City, and Waynesburg. These incidents in this chart are inclusive of driver complaints. A look at the types of incidents we're having shows 40% of them being vehicle incidents. Next, our driver complaints at 30%, followed by property damage at 20% and injuries at 10%. The primary cause of injury events is body positioning. 100% of our injuries have occurred because of this. When it comes to vehicle incidents, unsafe driving is our highest primary cause, at 43%. Being struck by a third party accounts for 29%. Striking a third party and backing each account for 14% apiece as a primary cause of incidents in vehicle events. A breakdown of our events in February 2020 shows that we had 0 recordable injuries, 0 first aids, 0 preventable vehicle incidents, 2 non-preventable vehicle incidents, 1 out of Odessa and 1 out of Carlsbad, and 2 property damage events, 1 out of Carlsbad and 1 out of Waynesburg. We'll begin with our non-preventable vehicle incidents, starting in Odessa on February 10, 2020. An employee was struck from behind by a third party. There were no injuries and only minor damage to our vehicle, which was driven from the scene. After police responded and took a report, causal factor here is we were struck by a third party. Next, we go to Carlsbad on February 19, 2020, where an employee was pulling into a parking lot of a convenience store. A third party backed out and struck our employee. The third party then drove away. Police were called to the scene and took a report. There were no injuries and only minor damage to our vehicle. Again, the causal factor here is that he was struck by a third party. Now we'll focus on property damage events, starting in Carlsbad on February 1, 2020. The laydown machine was hung up on a guardrail 40 feet in the air where personnel could not get to it to free it. Rather than asking personnel to place themselves in extreme hazard, the laydown operator pulled the guardrail down. The guardrail was then tied back and work resumed without further issue. Next, we'll look at one in Waynesburg on February 20th, 2020, where an employee was running their truck through the car wash when they noticed steam coming from under the hood. Upon inspection, the employee noticed damage to the driver's side bumper of the vehicle. It's unknown when and where the damage happened. Now let's look at our performance with observation cards from the previous month. For 2020, Pleasanton has submitted the most cards at 22, followed next by Odessa with 14. Kilgore has submitted 10 cards, Oklahoma City 8, Kiowa 5, Carlsbad 5, Waynesburg 5, and our sales team has submitted 1 observation. Taking a look now at the observation card rate for 2020, which again is the number of observations per employee at a facility, we see that Pleasanton far and away has the highest observation card rate at 2.0. When you look at this chart, you should look at the gray projection line, and if it's not above the red line, which is the target for the quarter, you should increase your observation activity. A comparison now of observations submitted in February versus incidents that occurred in February shows a 43% decrease in our observation activity from January to February. At the same time, we saw a 33% decrease in incidents. There was a 17% decrease in observations from February last year to February of this year. It is unusual to see a reduction in incidents when you see a reduction in observations. However, there are some other underlying factors that could contribute to this anomaly. One is the fact that activity is down, so our exposure is down as well. Taking a look at our safe observations, which is shown in gray, versus our at-risk observations shown in yellow, shows that the majority of our at-risk observations from February are tools and equipment, use of PPE, and working conditions. Drilling down into each of these categories a bit shows the condition of tools and equipment accounted for 100% of the at-risk observations in that category. When it comes to working conditions, weather played a part in 50% of the observations, followed by housekeeping at 33% and walking surfaces at 17%. The use of PPE drill down shows that eye protection accounted for 33% of the observations, followed equally by multiple head, and fall protection equipment, each at 17%. Face protection was 16% of the observations in the use of PPE category. Now let's detail each of these observations from these categories. The first observation in the category tools and equipment happened while using an impact wrench. The employee observed the socket to be cracked. The employee then stopped the job and told the shop foreman about the cracked socket. The socket was replaced and the cracked one was disposed of. Next was a third-party observation which happened while running the bottom hole assembly in the hole. The wellhead began leaking. It was tightened 4 times but was still leaking. The job was stopped and they nippled down the BOP. Next, they changed out a crushed BOP ring and retested the BOP successfully. The job resumed without incident. The next observation happened during rainy conditions when an employee observed a bad windshield wiper on their vehicle. The employee replaced their windshield wipers. The next observation from tools and equipment involves a forklift. The back floodlights on the forklift are not working and the other lights are inadequate for unloading at night. The employee spoke to the manager about this condition in an attempt to get it repaired. Please make sure that all equipment on forklift is functional, and if there's any question, have it looked at or replaced. Next, a leak was observed on pump iron. The job was stopped, and they shut a pump down. Next, they replaced the rubber and resumed operation without incident. Shifting now to observations from the category working conditions, we begin where roads are covered in ice and snow, which creates an extreme driving hazard. At this time, all unnecessary driving was shut down and the shop was closed for the day to minimize exposure to the employee. Next, the yard was covered in ice and snow, and employees were directed to use extreme caution and move at a slower pace around the yard. And finally, a third-party observation where a vehicle from another lane moved in between the employee and the vehicle in front of them. The employee had given more cushion because of rainy conditions, but the vehicle in front of them struck another vehicle. Traffic had come to a stop and the driver that had cut our employee off was on the phone and did not see it in time to stop. Please allow plenty of room and remove distractions when driving. If inclement weather is a concern while driving, allow more space between you and the vehicle in front of you than you normally would. We'll finish up with a look at observations from the category use of PPE. We start with a third-party observation where a truck driver, non-wildcat, was unstrapping a load and was observed not wearing their hard hat. The job was stopped and they were asked to put their hard hat on, which they did. Next, we observed someone buffing without safety glasses on. This was a wildcat employee. The job was stopped and they were asked to put on safety glasses. It should be noted that when buffing or grinding, a face shield along with safety glasses is required. The next observation in the category use of PPE happened while rigging up the hydro tester. The operator was outside of their vehicle without safety glasses on. The job was stopped and they were asked to put their safety glasses on, which they did. Next is a third-party observation when a non-wildcat employee was observed without safety glasses. Again, the job was stopped and they were asked to put their safety glasses on, and they complied. The next observation was a third-party observation where we observed a snubbing unit employee, non-wildcat, standing on top of a master valve without fall protection equipment on. The job was stopped and they were asked to put their harness on, which they did. And finally, a non-wildcat employee showed up to the shop without their hard hat or their safety glasses on. This person was stopped, and they were asked to put both sets of PPE on, which they did. Now let's learn about the coronavirus COVID-19. By now, I'm sure you've heard of coronavirus or COVID-19. You can't turn on the TV anymore without seeing it. But what are they, and just how dangerous is this? Coronaviruses, or COVs, are a large family of viruses that cause illnesses ranging from the common cold to more severe diseases. Chances are you've had a coronavirus at some point in your life. When you hear the term novel coronavirus or nCoV, it simply means that it's a new strain that previously has not been seen in humans. This particular strain of coronavirus has been named COVID-19 because COV stands for coronavirus, D stands for disease, and 19 is the year it was discovered, 2019. Again, with the increasing attention that this is getting in the news, it can be difficult to separate fact from fiction and truly understand the risk associated with coronavirus COVID-19. As of March 2, 2020, the worldwide impact has been felt in 68 countries. There have been almost 90,000 confirmed cases of COVID-19, and 45,074 people have recovered from it. There have only been 3,044 deaths associated with COVID-19, with the majority of the deaths coming from China, Iran, and Italy. Domestically, the United States has not been hit nearly as hard as the rest of the world. In the United States, we've had 45 confirmed cases, and as of March 2, 2020, only 2 deaths. The majority of the cases have been found in California and Washington state. Like I stated earlier, with the news coverage that COVID-19 has been getting, it's very difficult to separate fact from fiction and understand true risk. We'll take a look at some more common thoughts around the virus and determine whether they're myth or fact. The first, you're at high risk of contracting COVID-19. This is a myth. The virus does appear to be highly contagious, but for the average person, the risk of getting it is currently considered low. A vaccine to cure COVID-19 is available. Again, this is a myth. There is no vaccine for the new coronavirus at this time. Scientists are working on one, but developing a safe, effective vaccine could take many months, possibly even years. COVID-19 has the same symptoms as the flu. This is another myth. The virus does cause fever, coughing, and shortness of breath, with complications of pneumonia. But the flu tends to have more body aches and muscular pain associated with it. You can protect yourself by swallowing or gargling with bleach, taking acidic acid or steroids, or using essential oils, salt water, ethanol, or other substances. This is a myth. None of these recommendations will protect you from getting COVID-19, and in fact, many of them are dangerous or fatal. COVID-19 was deliberately created and released by people. This is a myth. Viruses change over time. Occasionally, a disease outbreak happens when a virus that's common in animals, such as a pig, bat, or bird, undergoes changes and passes to humans. This is most likely how the new coronavirus came to be. Hand dryers are an effective method of killing COVID-19. This is a myth. Hand dryers are not effective in killing the virus. To protect yourself against it, you should clean your hands with an alcohol-based hand rub or wash them with soap and water. We'll discuss proper washing techniques later in this presentation. Once clean, you should dry your hands with paper towels or a warm air hand dryer. Pets at home can spread COVID-19. This is a myth. At present, there's no evidence to suggest that companion animals or pets, such as dogs or cats, can be infected with the new coronavirus. It is always a good idea to wash your hands with soap and water after contact with your pets. Wearing a face mask will protect you from COVID-19. This is a myth. Certain models of tight-fitting respirators, such as those marked N95, can protect healthcare workers as they care for infected patients. For the general public, however, the benefit of wearing a lightweight disposable surgical mask is not clear. Masks could provide some protection from large drops, sprays, or splashes, but because they do not fit tightly, they may allow tiny infected droplets to get into the nose, mouth, or eyes. Also, people with the virus on their hands who touch their face under their mask may become infected. People with respiratory illness can wear these masks to lessen their chance of infecting others. With the coronavirus, COVID-19, reported illnesses have ranged from mild symptoms to severe illnesses and death for confirmed coronavirus cases. Symptoms can appear anywhere from 2 to 14 days after an exposure, which would include fever higher than normal flu at 104 degrees Fahrenheit, cough, and shortness of breath. Call your healthcare professional immediately if you develop symptoms and have been in close contact with a person known to have COVID-19 or recently traveled from China, Iran, Italy, Japan, or South Korea. The United States Center for Disease Control, or CDC, recommends that you do the following preventive actions every day to prevent the spread of respiratory diseases, including COVID-19. Avoid close contact with people who are sick. Avoid touching your eyes, nose, or mouth. Stay at home if you're sick. Cover your cough or sneeze with a tissue and then throw it away. Clean and disinfect frequently touched objects and surfaces with regular household cleaning sprays or wipes. Wash your hands often with soap and water, especially after going to the restroom, before eating, and after blowing your nose, coughing, or sneezing. And finally, if soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. While it may seem self-explanatory, proper hand washing is a huge preventative measure for stopping the spread of respiratory illnesses and COVID-19. To properly wash your hands, first wet your hands with clean running water from warm or cold tap, and then turn the tap water off and apply soap. Next, you'll lather the soap by rubbing your hands together. Ensure that you lather the back of your hands between your fingers and under your nails. Next, you'll scrub your hands for a minimum of 20 seconds. In order to be able to time it properly, you can hum the Happy Birthday song. Next, you'll rinse your hands completely with clean running water. And then finally, you'll dry your hands either with a clean towel, paper, or cloth, or an air dry system. COVID-19 is a serious illness, and the vast majority of people who are infected will self-heal without complications. COVID-19 is a respiratory illness and can be prevented with proper hygienic methods. As of March 3, 2020, there are 89,198 cases worldwide of COVID-19 versus over 1 billion cases of the flu worldwide. 86 U.S. COVID-19 cases are confirmed, and 9.3 to 45 million U.S. flu cases are confirmed annually. COVID-19 has killed 3,100 people worldwide. As of March 3, 2020, there were 2 in the United States. The flu has killed 300,000 to 650,000 worldwide, 12 to 60,000 of those in the United States. As you can see, even though COVID-19 is a very serious illness, it is not as deadly as people might think, and certainly not as dangerous as the news media would try to make you believe. This, of course, does not exclude you from taking proper hygienic precautions or paying attention to it and ensuring that you're safe from it. Let's finish with the focus courses on Wildcat University for this month. The focus courses for this month's Wildcat University training are fatigue management and cold stress. Again, as a reminder, if your dashboard shows current, do not take these courses again. If your dashboard shows anything other than current, complete the courses above.